So there are two main reasons why your catheter is able to flush, but you can't draw blood. First is clotting, second is CVR, catheter to vein ratio. Let's go over that one first. Most people, because they think bigger is better, put in the biggest possible catheter in the smallest possible vein. All right, so here is a diagram of CVR and why it affects your ability to blood draw. Draw blood, English. All right, so here is a regular vein with natural flow of the blood, no obstructions. Here is an appropriate catheter to vein ratio. Catheter, which the catheter is taking up less than 45 or 35% of the vein. I think they say 45, but I would try to keep it 35 if possible. But anyways, there's enough room, as you can see, for the blood to flow around the catheter to get to the tip of the catheter. Whereas if you squeeze in a too large of a catheter, it's actually obstructing the blood flow to the tip of the catheter and to the rest of the vein. Okay, so this is why your bigger is better is not always better. This is why you can't draw blood. Not only that, when you collapse, remember, it's a vacuum system. It's a sealed system. So if there's nothing to occupy that space, there's going to be nothing. So basically, when you apply any kind of negative pressure, it's going to close up even whatever's left of that volume. It's going to close up that part of the vein, and you're not going to be able to pull anything. I think I have an ultrasound video of this. Let me check. Here's pretty much what it looks like when you don't have enough blood flow to the tip of the catheter or enough reservoir of blood.
So I have to push.
So that's the needle right there. And this is our vein.
And look at how much that negative pressure. Oh my goodness. Look at that. That's just from using a regular.
Did you guys catch that? Right there. So this is baseline. After I added the vacutainer, that's pretty much closed up and sucked up that vein. That's what happens when your catheter is too big to allow blood flow to pool in reservoir enough for the catheter to be able to draw blood. Here's an example of what happens with the clot. This is called a fibrin tail. So that's what's going on. As you're able to flush and push the fluid out, there's a piece of the clot, a tail of the clot, that's going to close up that lumen every time you try to suck in the blood or draw blood in. So after watching this video, are you guys going to put the smallest possible catheter or the largest possible catheter for your patients? Put in the comments. Let me know.